The departments of pelvic rehabilitation medicine include physiatry, endometriosis surgery, and behavioral health. When a patient comes in to physiatry with suspected endometriosis, listening and history can really tell us a lot about the underlying potential diagnosis of endometriosis. We do see the signs and symptoms of endometriosis all day, every day in our patient population. So it really is that repetitive exposure that we have the benefit of really understanding the disease process at a deeper level. If our physiatrists have a high suspicion of endometriosis, we will refer our patient to our surgical endometriosis department.
My name is Dr. Laura Liu. I'm the head of the surgical department here at Pelvic Rehabilitation Medicine. The initial consultation with myself usually includes a very detailed history. I listen to the patient, listen to their symptoms, and really try to start from the very beginning and find out their journey. Once we decide that the patient is a surgical candidate, I refer her to my surgery coordinator. She'll call the patient, they'll set up a date to potentially have the surgery, and in between that time, if any diagnostic imaging is required, such as an MRI, I'll send the patient for an MRI. Then I'll see the patient one more time preoperatively, just to go over any other questions, concerns, just kind of outline what the surgery will consist of. We recognize that there is a significant mental health impact on patients with chronic pain and endometriosis, and we have a whole department of resources to help them with that.
Hi, I'm Dr. Alexandra Milspa. I'm the Director of the Behavioral Health Department here at Pelvic Rehabilitation Medicine. The Behavioral Health Department really helps emphasize the importance of caring for someone's mental health, emotional health, spiritual health, and physical health, particularly when they're about to go into surgery. Something like endometriosis can create a lot of post-traumatic stress disorder, as well as anxiety and depression. And if we don't help support the patients in navigating that and calming their nervous systems down, that will actually just amplify the inflammatory process from the surgery itself, which can slow down healing. The more someone has a feeling and a confidence of what to expect, the less fear they have. And the less fear they have, the more their nervous system is going to be calm, and the more their nervous system is calm, the less inflammation they're going to have, both before, during, and after the surgery. And that's been shown time and time again in research studies. What I love about the interdisciplinary approach here at Pelvic Rehabilitation Medicine is the communication between all of the providers. And sometimes a patient might say something to one provider, but forget to say it to another provider. And so that's what can be so important with this interdisciplinary care, because when the providers communicate, the patient is getting the best of both worlds. The more we can prepare the mind, the body, the heart, and the spirit, they're going to have the best possible outcome. And that is certainly the wish here at Pelvic Rehabilitation Medicine.
We really do provide that pre- and post-op full package care team for our patient population. As we all know, that's important in endometriosis, given it is a systemic inflammatory disease process.
At Pelvic Rehabilitation, we have the highest standard of surgery for endometriosis for our patients.
We're thinking from different avenues, thinking from different directions. That collaboration and communication sends the message to the patients that they're not alone, and that we will all work together as a team to provide the best care that we can in all realms of their experience. And we're here to support them.
For more information on pelvic pain conditions and treatments, visit our website at pelvicrehabilitation.com.